Good morning, everyone, and welcome. Today, we'll be diving into the important topic of relapse prevention with a fresh perspective. Our presentation, titled Transforming Relapse Prevention, a comprehensive approach to recovery, will explore the challenges faced in this area, innovative strategies that are making a difference, and how collaboration can lead to sustained success in recovery. I'm excited to take you through these insights as we work together towards more effective solutions. Let's get started. Relapse rates around the world remain shockingly high, which clearly shows that we're dealing with a serious and ongoing crisis. Even though a lot of resources and effort have gone into current prevention strategies, they haven't been effective enough in significantly lowering these relapse occurrences. This issue doesn't just affect individuals. It has far-reaching consequences for families and healthcare systems across the globe. All of this points to an urgent need for new, innovative approaches to relapse prevention that can make a real difference. Relapse is often triggered by a mix of factors like stress, environmental cues, and unresolved psychological challenges. Addiction itself is a chronic condition, which means it needs ongoing, personalized care rather than quick fixes. However, many of the prevention programs we have today tend to use a one-size-fits-all approach. This is a problem because they don't take into account how different each person's biology, environment, and social support systems are. Ignoring these individual differences is a big reason why many prevention efforts struggle to effectively stop relapse. To improve outcomes, we need strategies that recognize and address these unique factors. Relapse has a profound emotional impact not just on individuals, but also on their families. Those experiencing relapse often face intense feelings of failure and isolation, which can lead to strained or broken relationships. This emotional turmoil doesn't stay confined to personal lives. It ripples out into society as well. We see this in higher healthcare costs, reduced productivity at work, and increased pressure on social services. The economic consequences are significant, placing a heavy load on healthcare systems and entire communities. All of this highlights the urgent need for better strategies and solutions to prevent relapse and support those affected. One of the major barriers to effective relapse prevention is the lack of personalized care. Each patient has unique needs, and without tailored support, it becomes much harder to address the specific challenges they face in maintaining recovery. Another significant obstacle is the impact of societal stigma. Many individuals feel discouraged from seeking ongoing support because of negative attitudes or judgment, which can prevent them from accessing the help they need. Finally, gaps in follow-up and continuity of care after treatment create vulnerabilities. Without consistent monitoring and support, patients are more likely to relapse, making continuous care essential for long-term success. When we look at the current gaps in care and support systems, one major issue is the fragmented healthcare landscape. There's a lack of integration between clinical providers, community resources, and support networks, which makes it difficult for individuals to receive seamless care. This fragmentation leads to limited coordinated care, meaning that consistent monitoring and follow-up become challenging. Another critical point is the low adoption of technology. Tools like digital health platforms and remote counseling have enormous potential to offer proactive engagement and real-time support, but their use remains surprisingly limited. This underutilization hinders our ability to intervene quickly and effectively to prevent relapse. Addressing these gaps is essential for creating a more connected and responsive system. Here, we're looking at how innovative approaches are transforming relapse prevention through personalized and technology-driven solutions. First, AI-driven treatment adaptation allows care plans to adjust dynamically based on an individual's progress and specific risk factors, making interventions more targeted and effective. Next, mobile applications play a crucial role by providing timely reminders, practical coping strategies, and direct communication channels, helping individuals stay engaged and supported throughout their recovery journey. Wearable devices add another layer by continuously monitoring physiological and behavioral signs that may indicate an increased risk of relapse, enabling early intervention. Finally, telehealth services break down geographical barriers by offering remote counseling and ongoing care, ensuring support is accessible no matter where someone lives. Together, these innovations create flexible, accessible frameworks that significantly improve prevention outcomes. When it comes to recovery, the power of community and collaboration cannot be overstated. Peer groups play a crucial role by offering empathy and accountability, creating a space where individuals can lean on shared experiences. Family involvement is equally important, as it helps build a strong, supportive environment that reinforces recovery efforts. Beyond that, partnerships that connect healthcare providers, community organizations, and technology developers create an integrated support system. This collaboration not only strengthens recovery networks, but also builds resilience, making it easier to prevent relapse and maintain long-term progress. When we talk about meaningful reform, it's clear that systemic changes are crucial. This means looking beyond individual efforts and focusing on policies, funding, and integrated care models that work together effectively. One key area is the development of policies specifically designed to reduce the stigma associated with addiction and relapse. Stigma can be a huge barrier, so addressing it at the policy level helps create a more supportive environment. Additionally, we need increased funding that is dedicated specifically to relapse prevention initiatives. Without adequate financial support, these programs can't reach their full potential. Finally, advocacy plays a vital role in all of this. Advocates help push for the changes necessary to expand and sustain relapse prevention strategies, ensuring these efforts have lasting impact within the system. To truly tackle the challenges of relapse prevention, we need to embrace collective responsibility. This means that everyone has a role to play, from individuals to organizations and advocates. On an individual level, volunteers can make a huge difference by offering their time and expertise to support those in recovery. At the organizational level, providing funding and resources to innovative programs is essential to create lasting impact. Finally, advocacy is key. Champions pushing for policy changes at both local and national levels can help shape a more supportive environment for recovery. Together, these efforts can drive meaningful change. We've made significant progress in understanding relapse, which gives us real hope for the future. New tools and insights are helping us better predict and prevent it. One of the most exciting developments is the power of collaborative innovation. When we combine integrated care approaches with advancing technology, we open up new possibilities for effective relapse prevention. By working together across different sectors, we can dramatically reduce relapse rates and improve countless lives. This collective effort not only supports individual recovery, but also builds a sustainable path toward recovery that benefits communities all around the world. It's this shared vision that will drive lasting change.